I'm honored to be here again, as always. So I've entitled this talk the Business Staples and Changing Trends in Business. And this is a 30,000 foot look at the business of orthopedic. It's pretty hard to kind of get into the weeds in this short period of time, but most of this comes from our orthopedic practice up in northern Nevada, which has been there for 75 years, and we've, I think, been able to maintain kind of a cutting edge in the business of orthopedics. I don't have any conflicts, and I receive nothing of value from the presentation. I do have one comment before we get started. I wrote an article the last couple of years on being a provider. And bottom line is, I don't like the word provider, okay? None of us went to provider school, okay? So I think this insurance and the industry company has kind of lumped us all together in order to be a negotiating tool. And so I would encourage everybody to use terms like healthcare professionals, practitioner, physician, nurse, whatever you are. So when the little forms come through at your workstation and it says provider, I scratch them off and write surgeon or medical assistant. So it's like one way that you can kind of resist this. So anyway, there's my bully pulpit comment today. Business of orth, why is it important? Well, when you graduated from medical school, you did not think that you were going to be talking to an HR manager about your RVUs, seeing more patients, and not getting a bonus. And so I think in 2025, it's absolutely critical that you maintain some type of acumen for both medical and business skills in order to provide a high-quality product. And when I say the average business acumen, it just makes you more engaged in your business. You understand the finances. I think it makes you a better partner. And I think it makes you happier when you understand what the business and the finances are of the business that you're associated with. So what are the business staples, so to speak, for orthopedic trauma? Well, I always talk about these. These are really quick ways to save your hospital or your practice money. There's a bunch of hip fractures, and everybody in this room who participates in taking care of the hip fracture should participate in a geriatric hip fracture program. It saves time, money, it improves patient care. There's 1,000 articles that are out there now over the past 10 years. A trauma operating room. Everybody should have a place to work during working hours. You shouldn't start trauma cases at 5 in the afternoon, after the spine cases are done, after the joints are done. I should be able to come to work at 7 or 8 in the morning and work with regular people, not travelers or not people that are unfamiliar with orthopedic trauma cases. So you want your team there during the day. You do a better job. Operating efficiency. Traumatologists do a little better job than general orthopedic surgeons taking care of trauma because we do it all the time. And there's quite a bit of data out there that says that we can decrease procedural times and we can decrease the surgical labor burden for the operating room. Everybody needs a PA. They're just great. Patient satisfactions are up. PAs get the patients out of the emergency room quicker. The operating room loves them. You don't have to stick around so much, and they do a lot of work. So very, very high on physician assistants. Orthopedic surgeons are doing, traumatologists are doing more joint replacement, and so we need to have some type of implant pricing control. Whether it's a dual vendor, we do sole sourcing now, but you have to be able to control the cost, especially of the arthroplasty implants. Bone graft utilization, orthobiologic utilization. This has been around once again for quite a while, but I would encourage you not to exclude new technology. Just be cautious about indications and track it and use it when it's appropriate. And finally, I always encourage everybody to participate in their hospital committees. It provides visibility for your group. It exerts influence within the hospital system, and I think it makes you more active and gives a better image of your practice. Rather than talking about you, you're actually sitting at the table and contributing. So what are some of the changing trends in 2025? Well, there's a whole bunch of them, but I thought that these were the 5 that were most important. Number 1 is the ASC growth. Number 2, I think reimbursement, which we talked a little bit about yesterday. Our patients are now more educated, so-called one-stop shops, and then finally, digital health. So here are the Medicare certified ASCs by specialty type. Clearly, orthopedics, pain, and ophthalmology are the big drivers. And even corporations are now becoming involved. It looks like about a third of the newer ASCs are either partially owned or shared in ownership with a major company. This is the new outpatient center over in Sacramento at UC Davis, $500 million. It'll open at the end of this year. There's 48 operating rooms in there. It's really a beautiful facility. You should drop by, Ross, if you're over there. Here's the real trick. How do you manage fractures in an ASC? So we're looking at this right now privately. About a third of all the visits in our, not the trauma hospital, but in our community hospital are orthopedic related. And we think about 65% of those outpatient fractures could be treated in an ASC. But the trick is, how do you get the patients from the emergency room at the hospital over to the ASC? So it's a huge change in the treatment protocol for the emergency room doctors, for the residents, and for the fellows. But I think that fractures, just like total joint replacement, spine, arthroscopy, can be treated better, quicker, better outcomes. Patients are going to be happier. But it's just, how do we change the paradigm to get the patient from the emergency room over to the ASC and still maintain some kind of a relationship with the hospital? What about reimbursement? We talked about this a little bit yesterday. California is not going to get an increase in Medi-Cal reimbursement. There's just too many factors that are leaning against it. And Medicare and the Advantage plans are also in a little bit of flux. It's just not known what's going to happen, I think, over the next decade. You know, we're hearing about transparency and streamlined access and fraud prevention, but we really don't know how that's going to affect our rates over the next decade. I'll tell you what we do know is that we got cut again in 2025, and this is the 5th consecutive year that Medicare rates have been cut for providers. And the fact is that if you factor in inflation for medical practices, it's over 6%. So that's huge. So here's the take home. H.R. 879 is the Medicare Patient Access and Practice Stabilization Act of 2025. Call your representatives or your senators, or if you know people, call them and tell them that you want them to vote for this. I think it's still in committee. But this is a huge opportunity for us to exert some influence. These are just some members of the Board of Counselors. The Board of Counselors is a body of the Academy that advocates for some of these political issues. I attended this year, and all the states are represented. All these representatives take this on very seriously. Finally, what about our patients? Our patients are more educated than they've ever been, and the bottom line is that they want a surgeon who specializes in the interest of their operation. They want somebody who has a good bedside manner, who's qualified, and they want to go to an institution that has a good reputation. So the 3 A's, especially for the surgeons in the room that you were taught as a resident, which is availability, affability, and ability, are still in effect. What about our patient information? They used to get the information from their doctors or from the providers or from whomever was in the offices, but now everybody gets all of their medical information online. They get it from Google, Facebook, Yelp, Instagram, and so your practice or your institution has to have a very strong presence online. This is what drives the business to you. We have a couple of access to care issues in our practice. We have urgent care, which has been really successful. I think last year we saw over 200,000 patients. So this is the way that we can kind of feed patients into our ASC. So Saturday afternoon, your daughter falls and breaks her arm. She comes to the outpatient surgery, to the urgent care, gets a splint, and then next week is funneled in to see the specialist. And so these outpatient urgent care centers orthopedically are really helpful. HURT is a new app that we're working with right now. Consumers can take this app, download it. If you fall and break your ankle, you can take a picture and get immediate access to somebody who's either on call or an orthopedic traumatologist. One-stop shops are another area. Most patients don't want to wander around and try to find a brace, or once they see the foot surgeon, for example, and they're advised to get an insert, they don't want to have to drive across town. They want to go upstairs. Or if somebody has a backache, they want to be able to see the spine team. So everybody's kind of looking for one-stop shops rather than having to be referred to different areas around town. So we have our own DME, and anybody over 50 who has a fracture in our practice is seen in our bone health services. So these one-stop shops where people don't have to go additional places, I think, will also help and drive business. And finally, AI. One of our UCSF colleagues is on the Academy's AI commission. And I talked to him the other night, and he said that anything that you can do, they can do better. And so I'm not sure how this is going to fit into the practice of orthopedics yet. I think it will initially start probably for the office registration burden. I think it will probably help with the initial contact, doing the histories and the family histories and review of systems. And so by the time you see the patient, most of the kind of busy work has already been done. But we're not sure about the return on the investment and where the savings are really going to come. And then in progress, there's a lot of work already being done on imaging, customization of the implants, and clearly on research and data analysis. So in conclusion, I think ASCs are going to continue to grow. I think our reimbursement is going to continue to decline. I think our patients are going to get smarter. They're going to continue to use online resources. And I think digital health is going to be a huge contributor to our practice. And this is what I always tell the fellows, that God gave you 2 ears and 2 eyes so you could see better and hear better, but don't talk as much. Thank you.